Thank you so much, Mr. Speaker, and thank you so much, Cabinet Secretary. The one thing that does not come out very well is to what level is SHA or SHIF taken care of. We have situations, and I had a public participation just the other day, where we have patients who SHA have covered large amounts, and those that have been covered in very small amounts. So they keep on wondering. This guy was paid, the patient was paid, bill was paid to an extent of 300,000. There's this one who is requesting only 15,000. It is not being paid. So there's one thing that the Cabinet Secretary and his team must come out and tell the public. Continuous communication about what is covered by what to what extent. And lastly, Mr. Speaker, during this public participation that we had with our people, there are those who still want even to be told to be taken through on how to register, and they want to register, they still don't know how. And your medium of communication cannot rely on TV and newspapers only. Nowadays we have so much. You're even talking about AI being used now in the medical space. We have these influencers. We have these social media spaces that we need to have this communication go out again and again so that we demystify this thing about SHA. It is working, yes, but you get to a point where you have to still have to explain to people, Mr. Speaker. Cabinet
Speaker, the Cabinet Secretary needs to come out, as my colleagues have said, very clear on what SHA covers and what SHA does not cover. And I want to go on record, Honorable Speaker, my own mother stayed in hospital for 5 days, and SHA, out of her bill 213,272, SHA only paid 11,740. Honorable Speaker, Cabinet Secretary, what's not happening? Surely something is not being truthful. We are not telling the Kenyans the truth on what SHA can and what SHA cannot do. NHI probably used to pay better than this. We just need that comfort. Communicate very clearly, and the evidence is here. Hospital bill is here.
Kibagandi.
Thank you, Honorable Speaker. First, I would like to be very clear that the CS is talking about an ideal situation. That is not what is happening on the ground. Just like Honorable Oundo, my mom has been sick for close to 10 years now. In 2019, she was operated on. It is called diabetic foot. And the bill then came to about 625,000. NHIF paid 270 or thereabout. On Saturday, the bill for my mom, who has been ailing again and had to undergo 2 operations at Metropolitan Hospital in Buruburu because of diabetes, the bill came to 1.1 million shillings, and the bill that was paid by SHA is 123,000 shillings. I shared that with my chairman, and we shared that with the hospital. And Honorable Speaker, today I'm trying to control myself so that I don't demonstrate the unfortunate thing that happened the other day. What I would like to assure you, Honorable Speaker, is that nobody in this country has done research on SHA like I have. Number one, on issues to do with benefits. The benefits in SHA are inferior to what NHIF was offering. That is one. Number two, the processes of reimbursing hospitals is systematically oppressive to hospitals in the sense that hospitals now are too careful on how they handle patients. Number three, professionalism within the ministry, SHA, and every other space within the Ministry of Health, Honorable Speaker, we have trouble. And this is happening, including up to the counties. And, and at this point, Honorable Speaker, I would like to request the Honorable Cabinet Secretary, when people raise concerns, please don't politicize these concerns. Seek to have proper interventions for these concerns. Thank you, Honorable Speaker.
Thank you, Mr. Speaker. I want the Minister to confirm two questions. Number one is during means testing that those Kenyans who are perceived to have some stable source of income will pay more than those who do not have, so that we can be able to understand why Kibagendi's mother, NHIF, paid more than what SHA is paying her. If that clarification is done, then we can understand that in terms of means testing, the amount you pay is dependent on your perceived income. Number two, can the minister confirm to this House, because any new policy that the government implements must either generate into some small public problems, because it is new. You may think you are solving one, then 3 or 4 comes up. So can the minister confirm to this House that in his ministry, he has set up a team that will entail in collecting data, collecting those problems that are coming in implementing this SHA and SHIF, and that they are working around the clock to ensure that those problems don't recur again, because policy improvements are done by using feedback as a tool for continuous improvement. Can the minister confirm to this House that indeed Kenyans should be confident that SHA and SHIF will continue to improve because they are collecting data which they use as a tool for continuous improvement? I thank you, Chair. Yes.
Thank you, Mr. Speaker. Mine is just to ask the CS whether the ministry has ever done what I'll say, just go and do your tour to different hospitals, sample out, and get to learn what is the biggest challenge that we are facing as a country. Because when you hear the prices we are paying in hospital, I'll give you an example. CS, I know really covers so much on patients of diabetes. And we find a hospital, just the normal testing of diabetes, on the fee that they are charging is 700 per test when a patient is admitted in their hospitals. I will tell you today, I am discharging my mom. If I give you the figure we are paying for 1 week, 4 days, 3 million, doesn't make sense. Yusuf was here, the brother passed on 2 days ago. Stayed 4 weeks in Aga Khan, 11 million shillings. 200,000 was the dialysis test every time. We need now to come with a cap, and I want CS to look at it. Either you tell us the taxes on issues of health are so high that the hospitals should be charging this, or we bring a cap and we decide as a country, this is where a hospital can reach. If it is management, take a patient the way they do in the US to a management care hospice for Kenyans are going to go to the worst in this health system. Thank you.
Nabulindo.
Thank you, Mr. Speaker. Mine is very specific, and I would like to talk to Waziri. Waziri came to Mumias 2 months ago and had negotiations with our Bishop Kakamega, over St. Mary's Hospital, Mumias. And on that day, the CS announced publicly that St. Mary's Hospital is going to be opened the next day. Mr. Speaker, I would like to inform the House and the CS, if he's not aware, that St. Mary's Hospital is yet to be opened. The people who are getting services at St. Mary's are still suffering, And St. Mary's, this is an institution that was opened 1930. It has a lot of significance in Wangaland, and all of us have grown up using St. Mary's Hospital. In fact, several of my children have been born in St. Mary's Hospital, and another one will be born there next year if it will be open. So could the minister...
You are a very hard-working man.
Yes, I'm sure next year Mama will go there to get a baby. But the hospital is not open. So what will happen? So could Waziri tell us what is actually going on about St. Mary's Hospital? People are really suffering. Thank you, Mr. Speaker, and thank you for the chance.
Robert.
Thank you, Mr. Speaker. You know, NHIF had a very, very bad reputation, and due to its poor management of claims, and the CS has constantly made, mentioned that. But CS, when now you started deducting more money under the new arrangement of SHA, with a system that cost us 104 billion over a 10-year period, we thought that this issue of fake claims and this management of claims would be a thing of the past. Now, recently in a public baraza, you actually were saying that there's a lot of money stolen through the new system, and that you are actually going to take some cases to the DCI. I wanted to just know, does that mean that this new expensive system is not working? And so far, after you took your files to DCI, how many have been convicted and jailed? Thank you.
Honorable Speaker, let me start from the reverse. From my former colleague at Moi Forces Academy, many years, the deputy minority leader. Number one, the system does not cost 104 billion over a period of 10 years. And the government of Kenya is not paying a cent. Because the 104 billion should have passed through this house. So what is there is a fee for service. The system is built, and the Kenyans who use through the Digital Health Agency, then the developers of the system will be paid. Two, and very important that you have raised. In fact, the fraudulent claims and the facilities that were flagged off, number one, were flagged off by the AI system, fraud detection system of the digital superhighway, and then counter-checked by our clinical review team. As I said, Honorable Speaker, before I came to the ministry, and the SHA is just now 13 months old, the people who used to steal from NHIF went to SHA not knowing that this is a different animal. Honorable Speaker, you'll find a facility saying that there were 300 deliveries in their hospital, and all of them were C-section. That's even against the WHO rule. That is now a fraud. Or there are no birth certification. The system says, the system will check the documentation, or there is no even the legal document of the claim. So the system is the one that, and we submitted close to 118 files to the DCI with concrete evidence. I think up to about 20 plus he has submitted to the DPP. Once it has left me, it has gone to a different group called the criminal justice system. Some of them have been taken to court, very senior people in SHA, facility owners. And we will continue. And we have closed 184. And they are about, all of them, they're under investigation. So it is, and this fraud, same fraud is taking place in the medical insurance, private medical insurance scheme, even covered by Parliament. If you talk to Jubilee, if you talk to CIC, talk to them. The same problem SHA is facing is what they are facing. Because we had a meeting with them. In fact, today, if SHA suspends you from their portal, I can assure you 100%. that facility, all other private medical insurers will also suspend. Honorable Speaker, there were a number of questions, and you know the first one, let me start with the Honorable Tandaza. I want to assure you that I have the list of all the NGCDF payments available. The list also contains receipts and dates and months. And Honorable Speaker, to be honest to the House, I will table that next Tuesday. I'll make sure the leader of majority tables. I kind of want to assure you, and just to give you a sample, Subukia constituency, between 2024 to 2025, the amount is 156,000. Jomvu, NGCDF, 9,960,000. Chuka Iganga Ngombe, 2,700,000.